Welcome to Chapter 6, Epidemiology, the Science of Prevention. Chapter highlights for Chapter 6 are defining epidemiology, development of epidemiology as a science, the epidemiologic conceptual frameworks, applying epidemiologic principles and practice, assessment of health needs and assets, using assessment data for planning and implementing interventions, promoting healthy lifestyles, preventing and controlling outbreaks, contributing to a safe and healthy environment, and evaluating the effectiveness of health services. Before we get started into the content, I just want to highlight the fact that some of the principles and some of the frameworks that are going to be reviewed in this chapter are going to be, we're going to go into a little bit more depth in some of our following chapters, but the other thing is that some of the key concepts here and some of the key conscripts in this chapter are going to be important for your signature assignment. So keep that in mind. So first of all, defining epidemiology, distribution and determinants of states of health and illness in health populations, used both as a research methodology for studying states of health and illness and as a body of knowledge that results from the study of specific state of health or illnesses. So I want you to refer to table 6.1 in your text. A couple of key concepts or highlights there is to note the changes over 110 years. Quite a few changes in what the illnesses are. So at first glance, we might have changed what might have changed in healthcare or medical care to drive these changes. So things that jumped out at me are things like antibiotics available for communicable diseases, improved public hygiene. Just think of, think of 110 years ago and there was no Purell. There weren't as many as far as hand washing and that sort of thing. And certainly we didn't even understand a lot of that 110 years ago. And also the other thing I wanted to point out is that CD9 or now 10 coding language there. Part of doing any implementations or interventions is doing the assessment that we did about that, and the assessment oftentimes relies on the available data. And within healthcare and medical care, oftentimes the available data is what is coded and what gets billed. Sometimes you just have to follow the money and identify what you can do. In addition to that, I want you to refer to table 6.2 and note some of the very familiar names, and many that have made tremendous contributions that I've never heard of before. Many of whom who are responsible for the development of epidemiology as a science. And then finally, review table 6.3 in your text. See how John Snow's contribution to epidemiology and how even 150 years ago, how data can help us reveal where we might focus our efforts and our interventions. So continuing on with definitions that are important within epidemiology are a couple of key concepts of the epidemic, which is an outbreak that occurs when there's an increased incidence of a disease beyond that which is normally found in the population. Again, a bold. And then rates. So the primary measurement used to describe either the occurrence or the existence of a specific state of health or illness. Sometimes we're not really sure where we need to put our attention or our interventions and our efforts until we have an understanding of what the rates are and to be able to identify when something is more than anticipated. So again, as far as rates are concerned, we're going to be covering a lot more of that information in detail in Chapter 7. So the epidemiologic models, there are 4 here. They're clearly outlined in your text and gives you some really great details of these. But essentially, the epidemiologic triad, is the classic model based on the belief that the health status is determined by the interaction of those 3 characteristics: the host, the agent, and the environment, not just any single factor. And I think the key for this triad is the fact that if you equate it to putting out fires and fire safety. You know, you got to have fuel, you got to have oxygen, and you got to have an accelerant. And if you remove one, or you just need to understand what that what's contributing to a particular outbreak of something. So the host is the client. So both variable and modifiable and absolute non-modifiable. So the client, the host, is also affected by lifestyle, exercise level, nutrition. So think of the agent, and the agent is outlined with the 5 groups in your text. So there's physical, chemical, nutritional, psychosocial, and biologic. And then finally, the environments. The 3 categories in the environment are biologic, physical, and social. So there's a lot of determinants that go into the defining the whole picture, or having an appreciation of the whole picture of how a disease happens and how it's spread, etc. So the wheel of causation is the next concept that's outlined in the text, and that emphasizes the concept of the multiple causations, while de-emphasizing the role of agents in explaining illness. So again, we can't just blame everything on the environment. And one sort of catchy phrase that I thought of when I read this was the concept of nature versus nurture. Is it all biologic? No, there's certainly nurture. There's physical and social determinants involved in why it is that people get illnesses or spread illnesses. The third one is the web of causation, which is really a tool to reflect all of the specific factors. And think of the example in there is the example of the drug use, and it's not just one determinant. It's fairly complicated. And then finally, the natural history of disease, and identifying that was really groundbreaking. Developing that conceptual model for any disease which affects humans, and that was really the first time when that model was developed, when we started to understand about the primary, the secondary, and the tertiary prevention measures. Applying to different interventions, applying to whether it's prior to symptoms, after symptoms, or taking care of somebody that's in their last stages. Next, we have applying the epidemiologic principles in practice, and especially for nurses, this seems to be to resonate quite a bit with our nursing training. The whole assess, plan, implement, and evaluate. But in the text, however, is assess, diagnose, plan, implement, and evaluate. Diagnosis, oftentimes when I was in school, diagnosis was really considered part of the medical model and not necessarily the nursing model. But then we moved into NANDA and doing care plannings and that sort of thing, and all of a sudden it was okay for nurses to identify or to start using diagnosis terms. So in community health and also with public health, with this model, is that diagnosis is a key component of the continuum. So again, please refer to your text on table 6.4, and that really highlights the similarities between the nursing process and the epidemiologic process. Certainly examples that I saw were of both the client and individual based, as well as the population based aspects, and then see how the nursing practice and the process can apply to population and community level. So our training applies not just to the individual inpatient setting, but also to community health and public health as well. And furthering the epidemiologic principles in practice is that the text highlights the preventing and controlling outbreaks, contributing to a safe and healthy environment, and then evaluating the effectiveness of health services. And again, I just want to point out that in concluding my outline of Chapter 6 is that some of these key principles of this epidemiological principles in practice is that we're going to see those as part of the requirements for the signature assignment for the last group effort.